Today, Democrats in the state legislature gave healthcare providers an ultimatum: lower costs or we'll lower them for you. They introduced a bill to create a state-run health insurance option. Political specialist Sean Boyd is live at the Capitol. And Sean, this public option may not happen.
Hey, Kelly, here's the catch. If insurers and providers can lower costs themselves, no public option. They have 2.5 years to bring down premiums 20%. If they can't, the state steps in with its own health insurance plan, setting reimbursement rates that aren't negotiable. Providers either accept them or lose their license.
We understand our healthcare industry has gone through a lot responding to the pandemic.
Representative Dylan Roberts says he gets it. Now may not be the best time for upheaval in healthcare, but he says it's time the industry did something about the cost of care.
They come to us all the time and say, we know that costs are too high, we know prices are too high, but if you let us have the time to reduce them, we think we can do it. So we're going to take them at their word.
Under his bill, insurers would have until 2025 to bring down premiums on a standard plan by 20%, 10% a year, starting in 2023. If they don't, the state moves to phase 2, a government-run insurance option.
We feel like we're being set up to fail.
Amanda Massey with the Colorado Association of Health Plans says insurers don't even know what benefits they'll need to cover in the standard plan. That will be up to the Commissioner of Insurance. Until they know that, she says, they won't know if a 20% reduction is even possible.
Ultimately, it comes down to will providers and hospitals better negotiate with us or not.
Representative Amanjoda says the bill incentivizes providers. More affordable insurance, she says, will mean more insured.
Lowering it by 10% has the opportunity to bring in 70,000 Coloradans.
She's co-sponsoring the bill in part, she says, because she grew up uninsured and has a pre-existing condition.
Felt as if I was a burden on my family, and I don't want any person to feel that pain.
Pandemic or not, the bill sponsors say the industry needs to do its part.
When you look at the details of it, it actually is a pretty modest proposal.
The state isn't waiting on the industry before setting a public option in motion. The bill creates a quasi-governmental nonprofit to begin planning, including seeking a federal waiver and federal dollars for startup costs. I'll keep an eye on this one for you. Live at the Capitol, Sean Boyd covering Colorado First.